does your bed look like? When I got my first home and I could afford my own bed, I confess right now that I went a little overboard, about as overboard as some of the cakes you see in stores these days. I mean, you get chocolate and caramel and praline and Oreos, you might as well sell a kilo of raw sugar instead. But anyway, coming back to my bed, I have a grand teak wood four-poster king bed with the bottom half raised so that my feet can just about dangle off the edge of the mattress. And I have a memory foam mattress that has over time adapted to my shape and to my weight. So it's very, very comfortable just for me. I use two blankets. I have a knitted weighted one, which is like a hug. And I have a goose down feather blanket that I got in Norway 12 years ago with my first salary. My colleague went to the club and I went to home store. Anyway, the point I'm telling you all of this is that when I'm sick or I'm injured or I'm feeling anything less than superb, I want this bed. I want to curl up in familiarity. I want the scent and the feeling of home around me. I want the safety of family and people I know. And it is a worry that what if one day I am just too sick to recover at home? This is Sonali Acharji, and you are listening to Health Wealth, a podcast that hopes to leave you feeling much more aware of your health, but also to leave you with that motivation and the enthusiasm needed to actually make those right choices for your well being. I would never say that I hate hospitals. On the other hand, it's the irony is that I actually love them. I always feel incredibly hopeful when I get inside one of them because I look around me and I think that, wow, this institution is working to make me better. And, when you walk around and you see those billboards with, various information signs, I get really excited. It's like going to Disneyland for me. I'll be like, oh, a new test for predicting heart attacks or new medicine for controlling epilepsy. It's exciting for me and it's a great feeling. But all this is just limited to when I'm healthy. When I have even a minor headache, which is quite common these days with all the pollution and the traffic. But in these cases, I want to be at home. I don't want to be inside a hospital. And I remember this distinctly during COVID, that at one point, people were more scared that they would be lifted from their homes and put into an isolation ward than they were of actually getting that disease. And then in 2021, of course, we ran out of beds, which was even more scary because at that point you wanted to be lifted up and put into a hospital bed and you didn't have any. And there were a lot of cases where, people were scrambling for home care. And I remember, I called one very prominent provider of home care nurses. And they said, we don't have any nurses left. That was the sort of demand for setting up a sort of recovery zone at home. And that was actually the first time when I realized the importance of home-based medical care. Of course, dealing with the patient load, but also when I saw the people who were getting better at home, there was a certain sense of peace, which, later on in hindsight, they tell me themselves that they feel they wouldn't get that kind of peace if they were in a hospital. And I feel the same way too. I think I want to recover in a place where my mother's khichdi is a request away and I don't have to think if it's appropriate to press the nurse call bell at 2 a.m. to ask for a hug. But home is home. And now a lot of hospitals are getting into providing home care, and I thought it would be very interesting for us to understand a bit better about what home care can give us and and also seek the opinions of someone who's working in this sector. So we have with us today Vishal Lathwal. He is the CEO of Apollo Home, and he's joined us today to share his experiences. Hello, sir.
Thank you, Sonali. Thank you for the warm welcome to
Thank
your podcast. And let me also say this in the same breath that I have not, in my last 7, 8 years of working in home care, heard a better introduction or context to what home based care can mean for a patient or for a general person. So, thank you so much.
Thank you. Thank you. I think the thanks should go to you guys for actually getting into the sector, which is my first question. A hospital always has its own brick and mortar. Why would you want patients to not come to that institution? Why have you gotten into home care?
So, the question is very pertinent, right? As I said, that we've been a caring society all along, right? It's in our DNA, it's in our social fabric to care for the sick and the elderly, right? But hospitals do it because patients need it. I think that's the single most reason. Because medical attention, medical care cannot be provided by family alone, right? While they are there to comfort the patient, they're there to provide them assistance in daily routines. But medical care is medical care, and it's best left to professionals who trained or who are certified to do it. Hospitals are increasingly waking up to this idea because a lot of trends are shaping up in the Indian context. First is that as a country, uh, we are a population of billions, right? But at the same time, our hospital bed supply is still fairly limited. If you take any ratios, I'm not a fan of WHO numbers myself because I believe those benchmarks are at a broad-based average. But for an economy to grow faster, I think healthcare is the lowest common denominator that needs to be fixed. But even the WHO ratio of beds or nursing or the doctor manpower suggests that we are short of half of what is recommended, right? So there is a significant shift up or play up that is needed there. Now there aren't enough beds. Now what happens in the second context is that most of these beds get occupied by multiple types of patients and diseases, correct? The on that side, on a daily basis, if you see, the average hospitalization rate in India has gone up to about 4 to 5%, which means every year 50 to 60 million people are going into the hospitals. There aren't enough beds. So what will you do in this situation? One is that you ramp up the bed capacity, which is highly capital intensive and requires a lot of time, correct? On the second hand, what you could do is you could start looking at ways and means of taking care of some of these patients who can be pushed out of the hospital system sooner, provided the right care mechanism or ecosystem is available, correct? And that's where home care comes in. Hospitals are best placed to do this because this the biggest factor of shift of care is ensuring that the quality of care doesn't drop when you move out of the hospital walls, right? I've had the pleasure of working with two big hospital chains, Apollo being the largest in the country, uh, which is where I'm currently tasked to build this business for the patients and for the group. Uh, but hospitals are increasingly waking up to the idea and the promise that home healthcare brings in. First for the patients, and then in terms of unlocking capacity and value for the hospitals.
So, I asked the elderly person that I know, I said, I'm doing an episode on home care. Is there something you'd want to know? And she said, "Can you turn my home into an ICU?" So please tell me, can you have you advanced to that level?
So the technical answer is yes, right? Because uh, the the technology exists, right? The medical technology is amping up so fast around us. Everything's becoming smaller, more accurate, and it's becoming easy to move it out and make it portable and shift it to your homes. But it's not as easy as we say it or we put it, right? You can't replace hospital-based care completely into a home environment. You can't substitute a hospital. What you could do is that you could provide step-down care. So an ICU is not just a room where you have a bed and you have a lot of monitoring machinery. An ICU is actually the back end hospital teams, the multi specialists that are available that can be brought in. But what we can move to the home environment is step down ICU care, right? which is you will have the bed, you will have the monitoring infra, you will have the medical equipment available, you will have trained and certified ICU nurses, you would have attendants available to physically support the patient recovery. What we also can do is that we can provide adequate backup of remote monitoring to all such patients via remotely managed ICUs. Now there's technology available. And what we could also endorse is we could pre-qualify all of these patients and keep our ambulances handy given the hospital backup that is available to providers like Apollo or any other hospital providers who are getting into this. So the technical answer is yes, but it does come with certain considerations.
Yeah.
In short, a large part of the ICU care post a certain period of hospital stay can actually move to home.
That's
Right?
great news. Before we get more into what you can do in people's homes, to set this up for any hospital, because we have large chains like Apollo, we also have a number of smaller independent clinics. What kind of investment is needed in terms of, training the manpower or, the infrastructure? Do you think one day even smaller clinics can start to offer this?
See, home care today is still only 2% organized, right? So it's largely fragmented even today. But the difference between home care and quality home care is massive, right? So, and that's where the investments lie. So, investment is building towards quality frameworks. The first biggest step there is, as you rightly said, the front line, right? Who are you sending into patients' homes? So, there is enough training investment that needs to go in. There are enough compliance, background checks, verification of who's going in that needs to happen, right? That's one. Uh, this is the single biggest cost lever for any home care provider, just the manpower, right? Second is how are you ensuring that your clinical protocols, correct, are easily managed even in remote settings, correct? That's the second piece of investment, and that's where technology plays a huge role, right? And tech, uh, uh, while it's getting cheaper by the day, but for home solutions and other solutions, it's still a far way out, right? So that's a significant investment for somebody to come in. The third is there are quality accreditations available, right? Though limited, but for home care. So any patient who's choosing a home care, I would suggest that they look for some of these things. How is it that their frontline is getting trained? Do they have enough backup available in case something goes wrong, right? And third, are these players accredited? Are they sending in the right people, correct? So I can't give you a number because the number ranges. It could be as low as a few lakhs because you're just getting in people and then moving them into patients' homes. But a real home healthcare provider requires significant investment in upskilling and training of manpower and getting the right supply in, right, and the compliance checks. Second, enough and more spends on technology protocols, medical protocols, having doctors to support all these patients, right? That's second. And third is just the operational delivery cost because anything at home is a little more expensive than doing it in a facility, right? So it's like your food orders, right? It's easier to go out and eat in a restaurant, but there's a convenience cost which is higher,
But
right?
imagine if one day you could order a doctor home like that.
It's happening today, right? It's happening today. So in fact, in some of our markets, we realize that, for example, Bangalore, right? It's far
Yeah.
more cosmopolitan. It's moving at a faster pace. We are
Mhm.
sending doctors home in 90 minutes.
Wow.
But what we're also cognizant of is a physical visit is a physical visit, right? Everything in healthcare can't be done over virtual, right? So it can't be only tele solutions. So
Mm.
while there are enough and more apps out there that provide you a teleconsult on a single click, etc.,
Mhm.
but as home healthcare, we are very cognizant of the fact that healthcare delivery, you can't go wrong there, right? The margin of error is very limited.
Yeah, yeah, I
Right?
agree.
It's not like every other
Yeah,
home-based
yeah,
business out there, right?
yeah.
So it's very, very different. So we're very cognizant of some of those things, and this is where all the investment, cost, time, effort, energy, building
Okay.
right goes in.
Mhm. Imagine if you had to make promises like Domino's, doctor in 60 minutes or your money back. Uh,
Extremely difficult, as I
yeah,
said, because the ratios just don't support it. We just don't have enough doctors and nurses
yeah,
available.
I understand.
And I think they're better utilized in managing patients.
Yes, of course. So tell me, since we're talking about manpower, something that was in my mind is the safety of manpower again, because you're sending them into, people's homes and, within the hospital itself, we have had, so many instances of violence coming and, abuse and so on. How do you sort of navigate that?
So the challenge is real.
Mm.
Right? We can't run away from it. But these incidences, to my mind, are very far and few. Right? It's not the general norm. People, the general populace, diaspora, is still very respectful towards medical fraternity, doctors, nurses, and I think that respect grows multifold when they're in your environment, right? When they're sort of leaving behind their families to take care of you, sometimes even on public holidays, and they sort of let go of their own festivals and celebrations, etc. But as a provider, we are very, very cognizant of this, and we have the right frameworks and protocols in place to be able to take care of our people, right? So the first step is, how do we, for every patient that we onboard, we do an assessment upfront in terms of what could be the risk factors. So, for example, same gender deployments is something that's a policy, right? Uh, is the home location very remote, or is it accessible through public transport? And then if not, then we make provisions accordingly, right? We also counsel the family members in terms of what are the do's and don'ts, right? How do we work together towards the betterment of the patient and the care recovery? Most of our frontline also has solutions available to reach out to us at the back end immediately if they feel any amount of discomfort, and then we have provisions available to reach them as soon as we can and sort of help them out. But in my experience of being in the field for about now 8 years, right, such incidences are very far and few, right? So they are not something that's common norm, and it's equally our endeavor as a home care provider to build pride of a profession for these guys to sort of engage
Yeah.
in patient care.
So we did talk about, step down ICUs. What other sort of hospital-based environments or diseases can you deal with at home right now?
Okay, so a lot of things from the hospital can go home, right? So, and if you see majority through our lifespan, we would get hospitalized probably 4 or 5 times, right? Not a lot. But the day-to-day healthcare transaction happens when you have to see a doctor, when you have to buy medications, when you have to do blood tests, right? And this forms bulk of the volume transaction for health, right? And as you rightly touched in the introduction, we would be more happy that this pie or share becomes bigger, because preventive health is something that we really need to look at. It's just not a matter of conversation. It's a really important nationwide health agenda that we need to look at. But 70% of these transactions can completely be done at home, right? All of your blood work, all of your doctors, as you rightly said, all of this is available to you now on apps, through calling mechanisms, etc. Coming to what part of the hospital moves out is, uh, as I said, 3 to 4% of India is getting hospitalized every year. If I minus the infectious diseases, which is still a high burden for us, which is fevers and other medicine management cases, the surgical mix is going up because people can afford care, they can afford surgeries, they want to recover faster. There are those solutions available, right? We are also uncovering new diseases as we go along, right? We are living longer, correct? So, post surgery care or post operative care is a big segment or a big need where there's a huge care gap, right? So suddenly you get discharged from the hospital. There are hospitals who sort of keep a arm's length connect, right? But that's where you really need home care. In post surgery care, it is documented that if done well, can significantly enhance the overall outcomes for the patient, right? So post operative care, whether it is a nurse, whether it is sending a physiotherapist, or it is doing a step down ICU arrangement. Unfortunately, we also cater to uh, uh, patients who have indefinite recoveries or who are end of life, or now with the increasing incidence of cancer, they require palliative care and supportive care, right? So those are high end clinical need cases that are also currently being managed at home or can be done very efficiently and at one third the cost, right? So while familiarity is one element of it, cost is another element. And I think as a nation, or as a healthcare provider ourselves, our endeavor is to reduce the cost to serve patients. While we are affordable as a market overall, but I think home care just adds to that advantage.
Yeah. And tell me, would you also have services for stabilizing patients at home? Say someone's just had a heart attack, send in a team here to at least, resuscitate them in time, or for example, hypoglycemia, just a outbreak of low blood sugar. Would that sort of emergency care also, can that also be shifted at home rather than taking them in that, ambulance and the traffic and so on?
The answer is no,
Mm.
right? Because uh, as I said, you can't substitute a hospital, right? The underlying condition, while it may seem like a heart attack or it may seem like a stroke that's developing, but we don't know what all is wrong with the patient at that time. So the best is to provide medical assistance at the fastest, which is why you see emergency services being revamped, ambulances services being revamped, right? uh, so home care is supposed to do assisted long-term care and episodic care, but not emergency care.
And now this is a question which relates to our Indian culture of family and familial ties and so on. So when you're back home, you're in the hands of family, and you're a lot more willful than one would be in the hospital. So how do you ensure patient compliance when it comes to their rest, their hygiene, their diet? Because septicemia is a big concern always. So how do you make sure that they're actually doing what you're saying and the environment is clean?
Yeah. See, it's our innate nature to sort of discern from discipline, right? So I think just having a dedicated care provider in your facility, in your home, is I think the first step to ensuring, because the moment you know somebody is supervising your routine, etc., right, it becomes much easier for you to comply. There are also systems available. So by virtue of these care providers documenting how you're progressing, how your routines are, how you're following the compliance and protocols, etc. In a way, nudging the caregiver also if you see some outages there, right? I think I think that solves a large part of this compliance problem, right? Uh, Tech can further be used for cases where you don't have a caregiver at home, right? But we've seen in our experience that remote or virtual based care systems tend to struggle a little bit in terms of patient uptake of compliance, as opposed to when you have somebody physically available in your house.
Tell me about the rest of the family. How do you sort of get them to, not bring flowers and cake and, sort of, because I have seen that happen in an ICU, and and the guards were just sort of struggling to hold the person back. Ki, nahi, nahi, pool you can't take inside there.
Correct.
So
Correct.
how do you ensure that then?
Correct. Uh, in home environments, yes, there is always this tendency for the family or the visiting members at times to sort of behave a certain way. But I think, as I said, when we onboard, we spend enough and more time in terms of counseling the family members around what is important for the patient recovery. And it's our collective endeavor, right? It's not just the care provider in itself; it's the collective endeavor of the family to get the patient recover sooner, right? uh, Much easier. We also, in some cases where patients are highly sensitive to infections and otherwise, we have posters put out and what are the tips for people, correct? And there's enough and more scrutiny that is done by the care provider there. Uh, I think these steps go a long way, correct? And to my mind, it's not a big problem, right? Uh, there are those odd cases where family members tend to think that nutrition is inadequate, correct, and the patient needs to eat more to get better, right? So we have dietitians available. We also have counselors available, correct. So there are psychological counselors also available in some cases, because it's not easy for the family also to be around a patient, right? So, and to see them at home every day. So we also are very cognizant of human emotions, and they play out very differently. Healthcare is anyways a anxious space. Nobody comes in happy, right? It's not like you're walking into an ice cream store, right? Or as you said, going and buying a cake or a bed, right? So we are cognizant of that, and we put in adequate measures and enough communication. I think the answer is communicate, communicate, communicate.
Yeah, I'm really glad you brought up that mental health and emotional health aspect because it's something um, which just by being at home, a lot of those needs do get fulfilled because again, familiarity and so on. But also, if one is having a 24-hour caregiver from a home care service provider, are they also trained in how to bring sort of joyous moments or how to sort of brighten up the thing? Because I remember my mom has this doctor, and every time we're in hospital, the first thing he does is comes and opens up the curtains. He lets the sunlight in, and that itself helps so much. So, are these little things that one also provides training for?
Absolutely, absolutely, absolutely. And this is the investment that a good home healthcare provider will make as a hygiene check, right? It's not
Mhm.
something that we praise ourselves on. We understand the environment, and we are onboarding a patient towards a path of recovery,
Mhm.
right? And recovery is a lot more psychological in some of these cases
Mhm.
than actually only
Yeah,
physiological,
yeah.
right? Home A provides a familiar environment, so that's a positive to begin with, right?
Mhm.
You're around your people, it's not a stressed environment, you're not fully anxious at all times, right? Second, one is to one dedicated care, somebody is always available, right? So as you said, people often are very wary of pressing the nursing call bell in the hospitals, right? But at home you have them just by your side, right?
Yeah.
We also develop a caregiver bond, and we've seen that happen, right? There are caregivers who've been with patients for 5 years, 10 years,
Yeah.
through and through, right? And they in a way become part of the family. uh, so all of these people are trained on all of these aspects, the softer aspects, right? On keeping the room environment positive, light should come in, natural light should allow. What is the right nutrition? How do you talk to them? How do you deliver compassion, the right amount of touch, feel? How do you deliver care compassionately? They also trained on technical aspects of how to manage a patient when if something goes wrong. Correct. Some patients could have psychosomatic responses, right? So they're also trained on those aspects. What we also have is we keep supervisors mapped to patients.
Mm.
In case a caregiver needs support, then supervisor are also available to them and they can come in, they can fly in,
Yeah.
right?
Yeah.
Because what is also equally important as a trend and is happening is caregiver fatigue, right? So we also have to be cognizant of those aspects.
Mm.
So when we counsel the family members, we also sort of talk to them about this is what a caregiver is expected to do. They're also humans, so let them allow them also time periods, etc., of rest, right? Because that's necessary for them to be fully up to the mark to be able to take care of your family member. So
Because you
those are
feel
the,
so much of guilt, if someone is unwell in your own home,
yeah,
even if you have the means to go out, there's all that guilt that's inside that, you're doing something wrong.
yeah.
Uh,
So absolutely, absolutely. And as I said, see, we uh, home healthcare can be is a big space for to become an employment generator, right? There are so many people out there available who can be groomed, who, because as a nation we still have care orientation, right? So, and if they come in, for us it's very important as providers to ensure that there's right balance. They get the right amount of breaks. We have relievers available in case they fall sick. We have welfare mechanisms to take care of them in their sickness, right? It's a bit of a policy value system that we have in Apollo Home Care, that we take care of our people who intend can take care of your family,
yeah.
right?
Yeah.
So for us we have a caregiver first mindset on everything that we do.
Yeah. And so supposing I want to access home-based healthcare for not post-surgical care, but like just because I'm not feeling well, I have a cold or a flu or so on. How does the system work? Like, is there an app or a website, or how do I access it?
I think the best way is that, which is what most people do, is they reach out to somebody else who they know who's taken a service like this,
Yeah.
or their doctor or the hospital that they regularly visit, or you just type it online, right?
Mhm.
Uh, there are, I think, almost all home care providers have a patient helpline, right? So you can call them, you can access this. Some of the home care providers are also available online. It's equally important to go through reviews. if you don't know of the home care provider from earlier or from references. And as I said, uh, once you reach out, the way they manage the service will tell you a lot. So there would be, essentially, to my mind, home healthcare is not a product sale. You're selling a solution, right? So I think our first endeavor would be that if you call in, let's say if you call in Apollo Home Care, is to know what is happening. What kind of care do you need? Do you need somebody to just be there to support you in your daily routines, or is there a clinical need? If there's a clinical need, then we immediately deploy a doctor and a nurse to first understand what is needed for you, right? Because no patient is same, right? And no service is same accordingly, right? Then the tedious task of, once we've ascertained what type of clinical or non-clinical need is there, then the tedious task of matching the right supply manpower begins, right? Who is the right person to go into your house? As I said, gender matching, who's nearest available, right? Who's handled some of these cases in the past, right? So all of that goes in, and then you counsel the family, and then you talk about uh, how to onboard, etc., etc. Apollo Home Care, you can access us through a centralized helpline. You could go onto the website. You visit the hospital website, you will get it there. If you walk into any of our Apollo facilities, whether hospitals, etc., we have desks and kiosks available so people can reach out. So discoverability is not as much a problem, right? It's how you pick is what is very, very important when you choose a home care provider.
Um, just the last thing, and just because I like this podcast to also have a nice positive feel good aspect. um, do you have any memories or any stories in the last 7 years of a caregiver patient bond, or how home care might have really helped someone, even if it was in their last days or so on, but like the human aspect of this sort of care?
Enough and more, actually, and which is why this space is so gratifying, right? I'm not a healthcare professional by education, right? It was a personal chance opportunity that I got into this brilliant sector, and very soon realized that there's a lot to be solved outside the hospital space, right? Because in hospital, a lot of things are accessible to you, right? But with the moment you step out, or before you go into a hospital, there's so many queries that are running in your mind, right? Uh, if I recall one particular incident, uh, there was a caregiver who was at the patient's house, and this service ran for almost about a year. And one day, suddenly, uh, the family had brought in cakes, correct, etc. The caregiver was taking a break because the elderly patient, given that there was nobody at home, had sent the caregiver to buy some essentials. By the time it came back, they realized that something had been consumed, etc. Right? The caregiver sprung into action, did a quick sugar check, etc. Realized something was not right. Called in the doctor. The doctor was available, but in the meanwhile, used his own discretion to book an Ola, like a cab, right? And then rushed him to the nearest hospital facility. Correct. Once we reached, we realized that there was some element of food poisoning, correct, and that infection could have developed and meant something very serious for the patient in terms of quality of recovery, right? This action in itself, where the care provider thought that on their own expense they took this call, sent them there. The doctor sort of endorsed the fact that yes, this was a make or a break, correct. uh, it stems the fact that this relationship is very pious, and after that till today, on the elderly's birthday, they make sure that they call this caregiver and send him equal gifts, right? So there are many. I mean, if yeah, it's just countless stories, and I think this is what is so gratifying about being in this space, because these are real problems that we solve, right? And I feel blessed to be part of an opportunity like this.
Thank you so much for opening up to us. Thank you. It's really nice.
Thank you, Sonali.
You know, as much as I wish all our solutions could be found At home, I know that sometimes, we do have to be admitted, for a surgery or for an emergency case or for some diagnostics, which, you can't transport an MRI machine to my home. I'm aware of that. But I have, over the years of being a caregiver myself in various hospitals, discovered that you can get the same bonding with the people who are looking after you, with the staff, with the doctors. It just matters a lot on how you treat them. So this happened the last time I was staying in a hospital about a year ago. And the patient on the bed next to us was complaining, and she was very angry with the nurse on call at night. And the supervisor came the next day, and there was a long list of complaints. And then the supervisor asked me, like, has she been also, behaving badly with you? And I said, no, I'm really surprised because this nurse was so incredibly attentive towards us, so loving. She would drop everything and come running if, I asked her that the loo is a little dirty, or, I felt a lot of care from her end. And that's what I told the supervisor. And then when we were talking, the supervisor said, I think this is because you actually treated that nurse as a human being and not your slave. That you talked to her, you asked her, where she stays, how does she come to the hospital, what does she think, what's her life. And I think if you take the essence of human care and human bonding with you wherever you go, whether it's your home or a hospital, that's how you do get people to, give you that little bit of attention. Because someone who's overworked, someone who is on a night shift, someone who is might be living in a different city from their home, they also need a little bit of care from you. So that's my trick to navigating hospital care. And I'd love it if you could share yours. You can write to us at pods@indiatoday.com, or you can message us on 8588966996. And if you've enjoyed this episode and if it's added some awareness and knowledge and value to your life, then please leave us a rating. We are there on Apple, Spotify, YouTube, and the India Today website.